Hello, everyone, and welcome to our question lab. We're happy to have you here this evening as we talk about reproductive physiology. Leading tonight's session once again is Dr. Paris Vicaria, and he's going to introduce himself now. Paris.
Thank you, Sean. Hey guys, my name is Paris. I am a current dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went on further to do medical school. I also am an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
So let's go ahead and get into our first question here this evening. As you can see, our answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process, and we don't want you to see an answer choice that you're unfamiliar with that may cause you to panic after trying to answer the question on test day. So I've gone ahead and removed those. After that, we'd like to read the lead-in first. The lead-in is the last sentence of the question itself, and the reason we do that is because we want you to know what the test writer is asking so that as you're reading that vignette, you can pick up on all those relevant clues without having to reread that question and waste valuable time on test day. So let's go ahead and take a look at that lead-in now. Which of the following best describes the normal function of the hormone being tested? Which of the following best describes the normal function of the hormone being tested? After that, we'd like to ask our students how many steps they believe this question will require. And the reason we do that is because we want you to have an organized thought process. An example of a one-step question could be when you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. An example of a three-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples, I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. Excellent. I see the responses coming in. Let's go ahead and read that vignette. A 22-year-old woman presents to her physician with amenorrhea for 8 weeks. A pregnancy test is ordered. Which of the following best describes the normal function of the hormone being tested? And with that, I'll hand it off to Paris.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So, generally they start off by giving you demographics, and in this case, it's a 22-year-old woman. So automatically that's important because it can clue you in as to what you should be thinking about right off the bat. And then they usually tell you, why is this patient coming into the hospital? Why are they seeing the physician? And that's important to make note of those presenting signs and symptoms. And they also often tell you just how long it's been going on for. Is it a few minutes? Is it acute? Or is it chronic? Has it been going on for months? So in this case, we're told that the presenting sign and symptoms are amenorrhea for 8 weeks. As you can see there, this is a much shorter question. This is a physiology question. Okay, so they're asking us about a pregnancy test. And then the lead-in is asking us about the normal function of that hormone being tested and what would best describe it. Okay, so I think we've got a few steps here. I think we've got to figure out what hormone is tested by the pregnancy test. Step number 1. Step number 2, what is the normal function of that hormone? So I think we've got a nice 2-step question here, okay? So let's go ahead and let's take a look at those answer choices. And what we see here are 5 answer choices. And, when we work with students, we recommend that they actually start at the bottom with answer choice E and work their way up to the top. So, in this case, starting with answer choice E and then going up to answer choice A. And the reason we recommend that is because a lot of times we'll see students who start at the top, they'll see something they like and they'll select it without having gone through all the choices. And then sometimes they'll get that question wrong. So we recommend doing it this way to avoid making that mistake and avoid biasing yourself. So let's go ahead and do that now. Answer choice E, preparation of the uterus for implantation. D, maintenance of the placenta. C, maintenance of the corpus luteum. B, maintenance of the Graafian follicle, and A, increased prolactin production. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. As you can see, the poll is open. Once again, we will wait until about 2/3 of you have responded. Remember that there is no penalty for guessing on test day, and certainly no penalty tonight. So even if you're unsure of the answer, don't worry. Take your best guess. All the answer choices and submissions are completely anonymous, and then we will review the incorrect and correct answer choices here together in just a moment. Looks like there's a clear favorite, and we're off to a good start here. Let's take a look and see what all of you selected. Looks like 58% of you selected maintenance of the corpus luteum, and in distant second place was maintenance of the placenta. So let's take a look and see what the correct answer is. And the correct answer is indeed C, and 58% of you got it right. So a strong showing for the first question. Let me hand it off to Paris.
Thank you, Sean. Yes, definitely a nice job with this question. So what is this asking us about? Well, in this case, it's important to know what hormone is being able to be detected by pregnancy tests, and what is one of the main hormones of pregnancy, and that is human chorionic gonadotropin, beta human chorionic gonadotropin, or beta HCG. It is the hormone that is essential for maintaining that early pregnancy and what is measured to detect pregnancy. Okay? So it is detectable in blood 1 week after conception and in urine 2 weeks after conception. Okay? So let's take a look at the next slide. We'll go ahead and take a look at some of the normal functions of human HCG. You can see there that right away, it tells us that the HCG is used to maintain the corpus luteum. Okay? So immediately after ovulation, the corpus luteum produces progesterone. Okay? This makes the lining of the uterus suitable for implantation. And if a pregnancy occurs, the corpus luteum must be maintained so that it can continue to make that progesterone and continue to make that uterus lining really nice for that fertilized ovum. Okay? So to ensure that that corpus luteum is maintained in early pregnancy, beta HCG is secreted to maintain that corpus luteum. Eventually, the placenta will synthesize its own estriol or estrogen and progesterone, and you don't really need the corpus luteum, so that degenerates. So early on in pregnancy, you do need that corpus luteum, and that is maintained by beta HCG. So hopefully you guys understand why that's the best answer here. But let's take a look at the other answer choices. So answer choice E in this situation, that is talking about progesterone. That helps prepare the uterus for implantation. That is not the hormone being tested. That is also the talking about answer choice D as well, progesterone. Progesterone acts to maintain pregnancy. It also helps to provide maintenance for the placenta. Answer choice B, maintenance of the Graafian follicle, is done by follicle stimulating hormone, or FSH, which makes sense since we're talking about the Graafian follicle. And then what would increase prolactin production? That would be estrogen and progesterone as well. So again, those are talking about different hormones, not the hormone that was being asked in this question.
Excellent. Thank you very much, Paris. Great job, everyone. We're off to a good start. Let's keep that momentum going with our second question of the evening. Once again, the answer choices are covered up. That is by design. And we will begin once again with the lead-in. Which of the following best describes the normal function of the missing umbilical cord structure? Which of the following best describes the normal function of the missing umbilical cord structure? I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. And then we'll move on to the vignette. All right, I see some of our veterans have started to respond. Let's go ahead and take a look at that vignette. An infant is born at term to a 35-year-old woman after an uncomplicated pregnancy. On examining the umbilical cord after transection, there are only 2 vessels present. One vessel has a 90% oxygen saturation, and the other has a 50% oxygen saturation. Which of the following best describes the normal function of the missing umbilical cord structure? Boris.
Thank you, Sean. So what we're going to do now is we're going to go ahead, show you what we think are the important clues in this vignette and the lead-in, okay? And so again, automatically we're being told who this patient is. We're being told this is an infant, okay? And you know, there is going to be a little bit of a difference because these are physiology questions, so there may not be as much of a clinical vignette where they're giving us laboratory values, physical exam, and vital signs, okay? So in that situation, we do want to make note of what are those clues in the vignette that are going to help us understand what's going on at a physiologic level, okay? So in this case, they're telling us about the umbilical cord and specific vessels, okay? And they're telling us about different oxygen saturations in those vessels. So you can tell this is kind of a physiology anatomy type question with the reproductive system, okay? So then they're asking us about what would best describe the normal function of the missing umbilical cord structure, okay? So one, I think we've got to figure out what is that missing umbilical cord structure? And then 2, what is the normal function of that structure? So I think we've got a nice 2-step question here, okay? So once again, let's go ahead and let's take a look at those answer choices. And once again, we are going to start at the bottom and we are going to work our way up to the top. Answer choice E, transports oxygenated blood from the placenta to the fetus. D, transports deoxygenated blood from the placenta to the fetus. C, transports deoxygenated blood from the fetus to the placenta. B, connects the umbilical vein to the inferior vena cava. And A, connects the fetal urinary bladder to the allantoid. So once again, we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Boris. Once again, the poll is open. Some of these got cut off, but the only thing that cut off is the word fetus, but I'll read it to you again for good measure. E, transports oxygenated blood from the placenta to the fetus. D, transports deoxygenated blood from the placenta to the fetus. And C, transports deoxygenated blood from the fetus to the placenta. And B and A are there in full. Once again, we do have a special offer and raffle for all of you in attendance, so make sure you stick around until the end because you must be present to win. I see the responses coming in. We'll give all of you a few more moments here. All right, well, let's take a look and see what you selected. Once again, we have a clear favorite. 49% of you selected transports deoxygenated blood from the fetus to the placenta. And in second place, 25% of you selected transports oxygenated blood from the placenta to the fetus. So let's take a look and see what the correct answer is. And the correct answer is C, and 49% of you got it right. So great job once again. I'm gonna hand it off to Paris.
Thank you, Sean. Yes, definitely a nice job with this question. So what is going on here? We've got an umbilical cord structure that is missing, okay? The umbilical cord normally contains 3 vessels, okay? Let's go ahead and let's take a look at the next slide, and we'll take a look at what those vessels are. We've got 2 umbilical arteries, okay? And we've got 1 umbilical vein. The umbilical arteries return deoxygenated blood from the fetus to the placenta, which was answer choice C. Okay. We've got one umbilical vein, and that carries oxygenated blood to the fetus from the placenta. So a little bit backwards from what we think about with a normal human. Okay. So in this case, the umbilical artery, since that's returning deoxygenated blood, would be expected to have a lower oxygen concentration than the umbilical vein, okay, which is carrying oxygenated blood. And you can see there in that little cross section of the umbilical cord, that little kind of, I guess not really a smiley face, but you can see two eyes and a little mouth. Those are the two umbilical arteries and the umbilical vein, okay? So if we go back to our question, you can take a look and see that one vessel has 90% oxygen saturation. That is probably the umbilical vein. The other vessel has 50% oxygen saturation. That is one of the umbilical arteries. So I can tell you that we are missing one umbilical artery. And we said that that transports deoxygenated blood from the fetus back to the placenta, okay? So answer choice E would be talking about the umbilical vein like we just talked about. And obviously we just said that there's only one umbilical vein in the umbilical cord. Answer choice D, this is actually kind of a red herring. There's actually no structure that does this, okay? You do not send deoxygenated blood to the fetus from the placenta, okay? Answer choice B, this is talking about the ductus venosus. This is actually a vessel that is obliterated after the fetus is born, and it's found in the liver, and this does not run in the umbilical cord. Lastly, answer choice A, this is talking about the urachus, which is a remnant of the allantoid, and this connects the fetal bladder to the umbilicus, okay? Once again, this does not run in the umbilical cord, so also not the best answer here. So great job with this question.
Excellent, thank you, Paris. You know, oftentimes students get questions right and then they move on, or they just read the incorrect answer choices. We encourage you to review all of the answer choices, incorrect and correct, to make sure you got it right for the right reasons, and make sure that you're learning from all of the choices and how they are presented. That being said, we do have a coaching and tutoring program. You know, students come to us oftentimes, they say, you know, we're studying a lot, but our results just aren't matching the efforts or the time that we're putting in. Or I should have gotten that question right, but I missed it. Or I just can't happen to figure this out. Or what's the best study plan for me? And, you know, those are very legitimate questions and thoughts to have, and you're not the only one. A lot of students feel that way. And if you're one of those people and you want the guidance and expertise of a coach, reach out to us at rx-coach.com. We have a coaching and tutoring program. So if you're studying for your board exams, the first thing we'll do is administer one of our assessment exams. If you're not studying for board, you're studying for a block exam or shelf exam, we'll go by your syllabus and your learning objectives, and we'll make a personalized study plan based on that. We've been around for about 30 years. We have a lot of data, so we're able to give you a very customized plan that will make your studying much more efficient. And then we'll work with you to help identify your knowledge gaps and bridge them, work with you on your test taking skills, work with you on your timing and your stamina, really taking a holistic approach to your medical boards and studying. Of course, all of our packages do include RX 360 Plus, which includes bricks, our express videos, our flashbacks, and our popular question bank. We are one of the only tutoring and coaching companies out there that's developed our own resources, and that was in medical education for decades prior to getting into tutoring. So if you want an experienced team on your side, reach out to us at rx-coach.com. You can click on that free consultation tab to talk to us about the coaching program and how it can benefit you, and see if it's a good fit. If you want some general advice, we're happy to provide that as well. We do that via firstaidteam.com, our blog, which I encourage you to check out. Once again, that's firstaidteam.com. We have a free study planner there that you can download, as well as a lot of great articles, as well as information about upcoming events such as question labs and webinars with Dr. Towley himself. So once again, that website is rx-coach.com, and we'll share that link with you a little bit later as well. So let's go ahead and move on now to our third question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following is the most likely cause of this patient's abdominal pain? Which of the following is the most likely cause of this patient's abdominal pain? I'll give all of you a few seconds as always to respond in the question box and let us know how many steps you believe this question will require. And then we'll take a look at that lead-in. Take a look at that vignette rather. All right, I see some responses coming in. Let's take a look at that vignette. A 20-year-old woman comes to the emergency department because of a dull, aching pain in her left lower quadrant for the past day. She has not had vomiting, fever, chills, or abnormal vaginal discharge. Her last menstrual period was 2 weeks ago. Her white blood cell count is 9,500 and urine beta human chorionic gonadotropin is undetectable. Pelvic ultrasonography shows no abnormalities. Which of the following is the most likely cause of this patient's abdominal pain? Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And we actually have more of a clinical scenario here. So we've got a 20-year-old woman. That's the first clue that they're giving us, okay? And then they're telling us about her presenting signs and symptoms. She's got this dull, achy pain in the left lower quadrant. They also give us a little bit of time. They tell us it's been going on for the past day. So those are all important clues that you would want to highlight and make note of when you're trying to figure out what's going on with this patient, okay? Now, in this clinical question, they also give us some negative review of systems. So some pertinent negatives. She's not vomiting, she doesn't have a fever, she hasn't had any abnormal vaginal discharge, things that you would want to think about and potentially rule out when you have a young female with left lower quadrant pain that's acute, okay? They tell us about her last menstrual period. That's always an important question to ask all of your patients, okay? They give us some laboratory exam findings, and then they give us some imaging findings as well, okay? So we need to use all of those clues to figure out what is going on with this question. So I think this is maybe going to be a one-step question. I think we need to figure out what is the cause of this patient's abdominal pain. Okay, so we need to use all of those clues to come up with a diagnosis. Okay, now it's possible because we're doing a physiology question lab that we may need to go into the pathophysiology or the physiology of that diagnosis. When it asks us about the most likely cause, it may be asking us to go be a little bit more specific. So there's a chance this could actually be a two-step question, okay? So 1 to 2 steps depending on the answer choices. So let's go ahead and let's take a look at those answer choices. And once again, we've got 5 answer choices. So I think have just diagnoses here, so maybe more of a one-step process here. And I'm going to go ahead and I'm going to read those starting from the bottom, working my way up to the top. Answer choice E, uterine myoma. D, pelvic inflammatory disease. C, ovarian torsion. B, Mittelschmerz. And A, ectopic pregnancy. So we're going to go ahead and open up that poll. Go ahead and select the answer you think is the best choice here, and we'll talk about it in just a few seconds.
Excellent, thank you, Paris. Once again, our poll is open. This is our 3rd question out of 4 this evening. You guys have been doing it great so far. Let's keep the momentum going. I see a clear favorite already. But we're going to wait until about 2/3 of you have responded. All right, I see the responses coming in. Let's take a look and see what all of you selected. Once again, a clear favorite. 52% of you selected Mittelschmerz. In distant 2nd place was ovarian torsion, and in close 3rd place was pelvic inflammatory disease. Let's take a look and see what the correct answer is. And the correct answer is indeed B. So well done, everyone. Let me hand it off to Paris.
Thank you, Sean. Yes, great job with this question, guys. So we've got a few diagnoses here, as you can tell from those answer choices. So what's going on? Well, this patient, she's at the midpoint of her menstrual cycle. Her last menstrual period, or LMP, was 2 weeks ago, okay? So she's probably has post-ovulation pain, okay? Also known as Mittelschmerz. She's got unilateral lower abdominal pain. She doesn't have any signs of an infection. She doesn't have a fever. She doesn't have leukocytosis, okay? She doesn't have any abnormal discharge. Her HCG is also undetectable, so we know that she's not pregnant. We also know she has a normal pelvic ultrasound, okay? So we can rule out a lot of those conditions that we would want to think about. So what is Mittelschmerz? Well, if we take a look at the next slide, you can see there that it actually talks about Mittelschmerz. It's a transient ovulatory pain, okay? And it can sometimes mimic appendicitis as a lower left or lower right abdominal pain, okay? And it's usually due to prostaglandin release when that follicle gets ruptured, okay? And that prostaglandin, that blood, and that can cause some irritation of the peritoneum. So you can feel that pain, okay? And this is a benign process. If we take a look at the other answer choices, you can see that those can be ruled out. And uterine myoma or a leiomyoma or a fibroid, that would be most likely detected on an ultrasound. Pelvic inflammatory disease, again, we would expect vaginal discharge, fever, chills, and probably maybe more bilateral than unilateral. Ovarian torsion, that's a very severe pain in the surgical emergency, and you can detect that on ultrasound, which would show decreased blood supply to the ovary. Okay. Then lastly, ectopic pregnancy, very unlikely because the beta HCG is undetectable. So great job with this question as well.
Excellent. Well, great job, everyone. We've got 3 questions done. We've got 1 left, and then our special offer. Let's go ahead and get to our last question of the evening today on reproductive physiology. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following hormones is most likely responsible for a change in body temperature with ovulation? Which of the following hormones is most likely responsible for a change in body temperature with ovulation? I'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require. And then we'll read that vignette. All right, I see some responses coming in. Let's take a look at that vignette. A young couple trying to conceive comes to the clinic. A friend has suggested that the woman take her temperature daily to determine ovulation. Which of the following hormones is most likely responsible for a change in body temperature with ovulation? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? And so hopefully, when you guys get these physiology questions on your exam, you guys can figure out exactly what are those clues that you need to take note of so that you can figure out what's going on, okay? And so hopefully we've done that here today and that you've learned from that. You can see we also have another short question here, okay? They're asking us specifically about this couple that's trying to conceive and that they're taking their temperature to determine ovulation. This is something they used to do before the advent of a lot of this technology. So they're asking us specifically about the hormone that's most likely responsible for a change in body temperature with ovulation, okay? So I think this is, there's a high chance this is probably just a one-step question. I think we've got to figure out what hormone changes body temperature with ovulation, okay? So probably just a one-step question here. So let's go ahead, let's take a look at those answer choices. Let's see which hormones they are giving us. And once again, we're going to start at the bottom. We're going to work our way up to the top. Answer choice E, progesterone. D, luteinizing hormone, C, human chorionic gonadotropin, B, follicle stimulating hormone, and A, estrogen. So once again, we're going to go ahead and open up that poll. Go ahead and select the answer you think is the best choice here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Boris. The poll is open. Our last question of the evening. For those of you who are wondering what next week's topic is cardiac pathology. Cardiac pathology, we hope to see you here. Let's try to finish strong here with our last question before we move on to our special offer and raffle. I see the responses coming in. We'll wait a few more moments. Today has been, by average, the best responses and the most percentage correct out of any question lab we've done, so great job to all of you. Let's take a look and see what you selected. In first place with 48% was progesterone, and second place with 25% was luteinizing hormone. And B and A were pretty much tied for third place, estrogen and follicle stimulating hormone. So let's take a look and see what the correct answer is. And the correct answer is indeed E, and 48% of you got it right. So great job, everyone. Let me hand it off to Boris for his explanation.
Thank you, Sean. Yes, nice job with this question, and nice job with all the questions today. You guys crushed it. So let's take a look at this question. So the question is, which hormone is changing body temperature with ovulation? Okay. Now, as we talked about, shortly after ovulation, the corpus luteum produces progesterone. Okay. The progesterone is released from the corpus luteum after ovulation. Okay. If we take a look at the next slide, we can take a look at some of the functions of that hormone, progesterone. Okay. And you can see there that one of those functions is to increase body temperature. Okay. The hormone progesterone, it acts on the hypothalamus and specifically the thermoregulatory center that can change a woman's basal body temperature, so their resting body temperature, throughout the menstrual cycle. And the basal body temperature is usually higher during the luteal phase, sometimes up to 1 degree Fahrenheit. So potentially a woman can estimate when ovulation has occurred if they were to check their temperature daily. Okay, so that is because of progesterone. Okay, so let's go back. Let's take a look at the other answer choices in case you selected that. So luteinizing hormone, the surge of this hormone causes ovulation to occur, but actually doesn't have effect on body temperature. HCG doesn't have an effect on body temperature as well. FSH as well does not affect body temperature. And lastly, estrogen, that actually can potentially lower core body temperature. Okay. In states where you have low estrogen, like menopause, your body temperature can actually increase a little bit, and those are, what are commonly referred to in lay terms as hot flashes. So estrogen actually is a little bit of the opposite here. The best choice here is answer choice E. Great job, and I will hand it back to you, Sean.
Well, thank you very much, Boris. Great job, everyone. If you want to review these questions on your own, please make note of these question IDs or QIDs. You can simply type these QID numbers into the RX search field in USMLE-Rx. Pull those questions up so you can review them further and make sure you have mastery of them.